I'd like to invite the people in our panel to switch their cameras on. So we've got Jeremy, we've got Ed, Christine, Jeanette, if you'd like to put your camera on, Shalim, and other members of the project advisory group. We've got Sue Brown. I think, is Alice here from the project advisory group? Hi, Alice. Anyone else? I'm not quite sure. I can't quite remember who we were expecting. So we've got a real mixture of expertise amongst our panel, and we weren't going to ask people in turn to say something. We thought we'd just invite the panel to raise issues or kind of relate it to their own work or their own experience, or, you know, just to have a discussion amongst themselves. So over to you, panel, and perhaps before you speak, if you could just identify who you are and where you work, or what your experience is and your interest in this topic. So thank you very much, and over to our panel. Oh, sorry, just to say, just a couple more things before we start. You can post questions to the panel as they're talking, and we'll have some more opportunities for questions and comments at the end. And at the very end, I put a little poll. So if you see right at the bottom of your list of icons, there's a poll. So it'd be great if you could fill that in at the end of the webinar so we can get a bit of feedback from you. There isn't an opportunity for you just to write comments in the poll, I'm afraid, but we'd love to hear your feedback about the webinar on the whole, and if you'd like to contact us or identify yourselves for you know, us contacting you in the future, we'd love to hear from you. Sorry. So again, over to the panel.
Hi. So I'm Jeanette Blackburn. Can you hear me all right?
Yeah, that's great, Jeanette.
Yeah. Oh, hi. Yeah, I'm Jeanette Blackburn. I'm a policy manager at CQC, the Care Quality Commission, and I work primarily in adult social care services and do quite a lot of work on services for people with a learning disability and autistic people. And I'm heavily involved in a kind of an improvement program that we're doing to strengthen the way that we inspect and regulate services, I suppose, for that group. And somebody mentioned the quality of life tool, which was really good that that's been spotted. So thank you for raising that. I think one of the key things for us in our regulation work, particularly in services for people with learning disability and autism, is that you know, quite often we come across closed cultures, and you know, obviously that's a great risk to people's human rights and their well-being. And what we're trying to do is really improve how we almost inspect around that culture, and what is it that we need to be looking at beyond the systems, beyond the processes, beyond the, you know, the program of training, etc. But actually, how do we really get underneath the skin of what it really feels like to live here and to use this service? What difference does it really make to me and my well-being and my life as it changes over the course of my life? And the group, the quality of life tool was actually developed by the University of Warwick, and we've worked with them to adapt it for something that we can use in our activity. And as somebody pointed, it does focus on support, but it moves really, it's a set of prompts that helps inspectors to focus on the impact of things like a care plan. So that's lovely, having a nice care plan, and people might have been involved in putting it together. But how is that working in practice? What does that actually look like? And how does it translate? Is it really meaningful? Is it making a difference to people, and how? So that's been quite interesting for us, and really shifting that focus around the amount of time that we need to spend talking to people, listening to people, observing the culture and seeing what's happening, and not, you know, shifting the proportion of time from paperwork systems, etc., to actually just observing and being around and talking to people to try and really understand what is the culture of the place, how is that affecting people, what does it feel like to live here, and what does that mean to me as an individual. So that it's an important shift, I think, and it's certainly an important tool, the quality of life tool, that's helping us focus our efforts and attention. You're on mute.
That's a really interesting, it goes back to kind of, you know, the issue about kind of culture, which is such an intangible concept. Maybe other people in the panel would like to reflect also on what you've said, or perhaps you've got some other points that you'd like to raise.
I come in, it's not specifically on culture, but we've heard a lot about leadership and systems. And I think the other thing, which we perhaps been a bit more silent.
Could you just introduce yourself, Jeremy? People know who you are.
Apologies, yes. My name is Jeremy Porteous. I run a learning network for housing and social care practitioners called the Housing LIN, the Learning and Improvement Network. We have a particular focus on older people's housing, but also for people with complex needs, LD. And previously, I worked for the Department of Health as the housing advisor on funding a lot of this type of accommodation. I really wanted to reflect on not just the leadership and the culture, but the language. And I think that for many people working in a housing setting, will be tarnished with the concept of housing being a special need. And we need to move away from this really rapidly. And somebody put in the chat box around, I think it may have been Jeanette, it may have been Donna actually, around social care futures. We really need a new language around independence and independent living, and not just think about special needs housing or specialist housing. One of the challenges, I think, at a higher level, and this perhaps comes back to what you were saying, Deborah, about at a policy, is how can we raise our ambitions around what the housing choices are, grounded in that social justice and rights-based approach. So, and again, that will require leadership, and it will also require organisational, cultural changes, but also to give confidence and meet the aspirations of people who, for many, often the lack of suitable housing choices aren't available locally, especially over the last 18, 20 months because of COVID.
Yes, that's really interesting. So maybe some thoughts from other people in the panel. Ed, were you? Wanting to jump in. Yeah.
Thanks. Thanks ever so much. First of all, for the invitation to come on today. It's been a really excellent set of presentations and discussion in the chat as well so far. I'm Ed Hall. I'm a reader in human geography at the University of Dundee and have done research on learning disability for a number of years now, particularly around social exclusion and inclusion. And I just a couple of reflections on what's been said. I think what's been really important is those three different aspects of home which have been picked up, and as other, whether it's the personal, social, and the sort of the built part, you know, the object part of it. And I think often housing and home is seen purely as a service provision, as a set of services and buildings, rather than as this whole systems approach, which was referred to in the last presentation. I think it's really important to as a starting point, just see the dynamics between those three parts. And I think there's been a lot of emphasis, to think back to Andy's presentation at the start, around seeing group homes, supported accommodation, as places in and of themselves, as a social environment. And what I would add to that, I think, is about these focus on social relations. Firstly, between the people who live in a group home and the staff. And I think there's been really interesting work about recognition theory and from Honeth and this group, in terms of thinking about how people, both the staff and the people that they're supporting, understand the roles that they're taking on. I think that staff user relationships are really important. I think the other thing I would emphasise is about connections outside of group homes as well. And I think there's been some comments there about in the presentations about how people feel placed within a broader community, and I think that's really really important. Often, sometimes we tend to think kind of internally, and I think it's that, which is important, but there's also those links outside. I think the final point I'd make is, and I think this has come across really strongly in all of the presentations, particularly about the quality checking, and when Shalene was and Katie were talking, is about the voice of people in homes. And when I say the voice of people, I mean obviously people with learning disabilities, but also the voices of staff as well. And I say it's that dynamic which often creates the culture which can lead to a very positive outcome, or a less good outcome. So I'll just pause there. Just a few thoughts off the back of a really interesting set of talks. Thank you very much.
Thanks, Ed. Well, that's raised a whole bunch of new thoughts and questions. Maybe people who might be coming more from a lived experience or advocacy position. So maybe, I don't know if Shalem, Christine, Alice or Sue, you'd like to weigh in with some of your reflections on what's going on. Shalem, you go first.
So my name is Shalem. I'm an expert by experience. I'm based in London. So I cover residential care homes and supported living. So yeah, I think the kind of dynamic between people living in their homes should be very culture-based, and also able to kind of feel comfortable and able to kind of reflect on the certain types of staff that they interact. And I think it's also about kind of seeing your future and where you want to live in the next 5 years' time. You might want to be able to have your own home and feel comfortable and able to invite your friends and have that freedom and not have barriers, and just kind of feel that you've achieved that goal, but also trying to kind of have that kind of momentum as well, and support network, and also working with your managers to kind of support the families who need that as well.
Wow, another set of really, really interesting points there. And, you know, when we talk about culture, it could be things that you're talking about, Shalem, you know, like how are people getting on? Like how are they talking to each other? The residents between themselves, how staff are talking to them. And if people are kind of expressing their hopes and dreams for the future, do those things really get listened to, or do they get kind of ignored and brushed under the carpet? Thanks for that. How about our other expert panel members? Maybe some thoughts from you.
Okay, I thank you, Shalem, and thank you to all the presenters this morning. I'm Christine Burke, and I work for the Foundation for People with Learning Disabilities, and I chair with Shalem the advisory group for the project, for the Homeliness Project. Thank you for all the comments, and it's really interesting because it's a subject that we've been having conversations about for many years, because whatever you do, services remain services. And like what Shalem is saying, is somewhere where someone lives which has aspirations. And then when we ask people with learning disabilities what they want from their lives, they want the same as everybody else. They don't want to belong to services, just like I don't want to be in a group home when I grow older. I'd rather go to Dignitas or something instead. But it's the same sort of principles, and we dehumanize people. And I think it's important that we humanize and we start to realize that we're talking about human services and active human support. And it's not about services, it's not about the system. Okay, I agree there's staff that need to be looked at and supported, but their roles should be specific to my needs and nobody else's needs. And it brings me, I always share a story, so I'm sorry if I stick to pattern, but I remember asking these women, what was the best day of their week? And they said Sunday. I asked them why Sunday was such an important day, because they could do whatever they wanted. They could stay in their pajamas, they could have coffee and breakfast, they could go out with their dog, they could go donuts in the garden. And I said, why can't you do any of that during the week? Because we have support during the week. And if having support means it stops you having a life, then hardly worth having that support. But then the flip side is someone who needs that support but never gets it. And it's important for us to be thinking about support rather than housing, somewhere where people live. And it's time we change the narrative really to a human service, to what we want. What do we want for our lives? And we started talking about what we wanted in the beginning. And it's so important that we think about what we want. And Shalim was very clear. I have dreams, he says. I might want to buy my own home one day. Why not? You know, if that's something that you can achieve, touching people's dreams, we say, what's important to and for people is so important. And we forget the narrative of person-centeredness and individuation. So sorry, I'll stop there.
That's great. Thanks so much, Christine. We've just got a little time for maybe Alice or Sue. You don't have to pile in if you don't want to, but I wanted to make sure that you had the opportunity to add your thoughts and comments.
Do you want to go, Sue?
You go first, Alice, that's fine.
So I'm Alice, I'm an expert by experience, same as Shalim. I've got a sister who is currently moving into supported living again. And yes, I say thank you for all of the presentations this morning, very thought-provoking. And yeah, I mean, I've been to lots and lots of residential homes and supported living homes, and some of the best places that I've been have just got that balance and that boundary just right between the staff feeling like it's a workplace and the residents feeling like it's a home. Yeah, it's the most important bit. So I'm really glad to be here. Thank you.
Thanks so much. Lovely to hear from you, Alice. Sue, would you like to add anything at this point?
Yeah, hi, I'm Sue Brown from Ambient Support. We're a supported living provider for LD, autism and mental health. And it's so nice to be part of the project that we've kind of really wanted to be started from such a long time, is to give a voice to the people, to say, this is my home, this is how I want it to be, because that empowers the staff to kind of concentrate that way, rather than concentrating on the paperwork to, you know, satisfy CQC and all the right ticking the boxes. This is their home, their voice, and the support goes their way. So that's a really lovely project to be involved with.
Well, that's a great endorsement. I can only say thank you. We didn't pay Sue to say this. And, you know, I mean, there have been some interesting questions in the chat, quite a lot directed at Jeanette, which maybe we won't have time to address, but I think it really maybe highlights that people want to get into conversation and debate with inspection and regulation. I mean, one question from Paul about how, you know, if we're looking at quality, we maintain a focus on homeliness and less tangible aspects of support. I think that's a really good question. And another question from Donna about the tool. I'm not quite sure what one that was, but maybe we talked about a quality of life tool and how that might be developed and used. I think we're kind of coming to the end. I feel very bad about the people who didn't get in to the meeting. But never mind, we've got a recording. We're going to send everyone a copy of the recording. We'd love to keep in touch with all of you, but we need to make sure we've got your permission to keep your details. So if you wouldn't mind going on to the poll, so it should work. If you tick at the bottom, I think I have to do launch poll. There we go. Feeling at home webinar feedback. It will only take a few minutes, so people can identify that. And if you could just fill that in quickly, it's really good for us to get some feedback, and any other feedback you've got, please post it in the chat, send it to me personally, if you'd like to be involved. So once you give the feedback, we'll be able to follow up if you'd like to be part of the research, or for us to keep in touch about what's going on. Keep checking our website, keep tweeting about what you've been hearing, and hopefully the people who didn't get in aren't kind of sending horrible tweets about the organisation of the webinar. I'll just give you a couple of minutes to finish, but this is the end of our webinar. it's been a fantastic experience meeting such a great group of people. I'd like to say a special thank you to the members of the research team and to our fantastic experts. Please keep in touch. So
thank you.
You'll have a really good day. Thanks so much, and great to see you. And hopefully we can have more interactive discussions somewhere further on down the line.